Hi everyone, welcome to the Spring 2025 Symposium. My name is Azan Yousaf. I am a senior Edge fellow and service learner. I just want to say, take a moment, I guess, for myself, but thank everyone in the department. Thank Jenny, thank Julia, thank Dr. Stivers, thank Dr. Wu, thank you to Stephanie Cruz, thank you to Dr. Buss, who I've been working with. This is going to be kind of emotional for me. It's going to be my last symposium. I've been doing this for 4 years and it's been really a wonderful experience. And I think one of the best aspects of the whole service learning journey is this symposium that we're doing right now. It's time to take reflect and Dr. Loco as well. She's also part of the department. Just saw her. Yeah, a lot of people to thank, a lot of people to be grateful for, and it's a showcase for you guys. You know, all the work that you guys have been doing, everything that's been important to you, and the bonds that you've made with your community partners, being able to share that and highlight that, I think is extremely crucial and important. And I'm glad that we're able to celebrate this with you guys. So, starting off with me, I can kind of tell you guys a little bit about what my capstone was with Rotocare. So like I said, my name is Azan Yousaf. I'm a senior. I'm double majoring in biology and social justice. And for my capstone, I wanted to focus on something that's really personal to me, which is access to healthcare when you're uninsured, undocumented, or just left behind the system. I volunteer at Rotocare, which is a wonderful free clinic in Marin County. And what I started to notice beyond the charts, beyond the forms, were these incredibly powerful stories, stories that no one was really documenting. At first, I was there to just scribe, type patient symptoms, track provider notes, all of that. But patients started to open up when I started interviewing them, not just about their illness, but about their lives. One person told me how they were avoiding care because something happened with their insurance and Rotocare. They didn't know about Rotocare until they had to Google it to find out about it, and they weren't able to get care for months because of that issue. Um, and the more I heard, the more I realized that these stories weren't just data, they were evidence. They exposed real cracks in the system, but no one was recording them, not in a way that could be shared without risking someone's safety. So I really started to ponder and ask myself, how do I document this in an ethical and safe way? And that's when I turned to AI. I used AI avatar animations and voiceovers so that no one's face or voice would be exposed, but it could also humanize the aspect and really get their stories told, especially here in Marin County, where we live in such a bubble, we tend to ignore the struggles that others are facing. But it wasn't just to sound high tech. It was just for their protection to let people share honestly without them having to be afraid of what the consequences could be. The videos weren't flashy, they were raw. They were based on real interviews that I translated and coded for themes like cost barriers, immigration fees, immigration fear, discrimination, and even medical neglect. I also had to get IRB approval, which taught me a lot about ethics and storytelling, how consent isn't just a form, it's really a relationship. We always talk about social determinants of health in public health classes, right? Transportation, housing, legal status, but this project really made me feel it. Imagine needing a referral for cancer screening but not having any coverage. Imagine being told you don't qualify for Medi-Cal because you make over the income cap, but you're still considered in the poverty line because you're in Marin County. It made me realize that being a doctor alone wasn't enough. I don't want to just be a provider. I want to change the system itself. I want to work on the administrative side to actually change policies to keep people locked out. But I just want to say that this capstone isn't the end for me. It's a framework. I want other students to pick it up, use AI ethically, listen deeply, and center stories that don't get airtime. I'm grateful to Rotocare for the trust and to the patients who shared with me. And honestly, I'm leaving this project not with answers, but even with more of an urgency to act. Because if these stories aren't shared, the policies don't change. And if the policies don't change, we're just putting band-aids on broken systems. I want to keep ushering this, but healthcare is a human right, and we need to act like it is. Thank you.